Hi nurses. So let's continue thyroid disorders today again. So in the last video we talked about hyperthyroidism and hypothyroidism main differences. Now if hypothyroidism as well as hyperthyroidism becomes worse, अगर T3 T4 extremes ਦੇ ਵਿੱਚ increase हो जान, it becomes thyroid storm, thyroid crisis, correct, thyrotoxicosis. और अगर hypothyroidism worse ਹੁੰਦਾ है, this is myxedema coma. Both are priorities, correct. Now the question is कि thyroid storm क्यों होगा? Why T3 T4 increases in extreme? Okay, first thing, when we palpate the thyroid gland, palpation ਦੇ ਨਾਲ ਜਿਹੜਾ stored hormone ਆ ਉਹ extremes ਦੇ ਵਿੱਚ release ਹੋ ਸਕਦਾ and thyroid storm ਆ ਸਕਦਾ body 'ਚ. So do not palpate the thyroid gland. Yes? Okay. ਕੋਈ infection ਹੋਈ, ਕੋਈ trauma ਹੋਇਆ और ਆਪਾਂ thyroidectomy ਕੀਤੀ client ਦੀ surgery. Thyroidectomy ਦੇ ਨਾਲ during surgery gland manipulate ਹੋਇਆ और ਜਿਹੜੀ storage ਸੀ ਉਹ release ਹੋ ਗਈ. No doubt after thyroidectomy we have to give the thyroid hormones lifelong, but immediate after the surgery client may have thyroid storm. But check the question carefully, what it indicates. Question ਜਦੋਂ ਆਪਾਂ ਨੂੰ thyroid storm related ਆਊਗਾ, thyroidectomy ਦਾ ਹੋਏਗਾ, we need to check whether it indicates ਕਿ client ਨੂੰ hypo ਹੋ ਰਿਹਾ or thyroid storm ਆ. So answer accordingly. Okay, so if there is thyroid storm in the body, temperature काफी ज़्यादा high होगा, maybe 103, 104, yes, and pulse काफी ज़्यादा increase होगी, client का blood pressure increase हो सकता, and shortness of breath. So these are the main findings, and along with these कोई GI sign and symptoms, nausea, vomiting हो सकता, diarrhea हो सकता person ਨੂੰ, correct. Okay, so what we can do now? Now we need to reduce the temperature of a client. ਆਪਾਂ acetaminophen देवांगे. Client ਨੂੰ pulse rate काफी high, BP high, we need to give beta blockers to the client to lower the BP and heart rate. Yes, and now anti-thyroid drugs will be given IV. They are choice of drug in the thyroid storm PTU. Propyl thiouracil, we need to give the client IV, correct? So keep in mind. Okay, and rest is the supportive care. We need to give oxygen to the client and we can elevate the head of a client. So other is the supportive care. Yes. Now let's move to the myxedema coma. T3, T4 are less in extreme. Hypo ज़्यादा worse हो गया, temperature ज़्यादा drop हो जाएगा. We need to maintain the body temperature, correct? And BP ज़्यादा drop करूँगा, pulse ज़्यादा drop करेगी, yes. And now body acidosis होगा, respiratory arrest हो सकता है. So levothyroxine is given IV now. Hypothyroid दी अपनी इको main choice of drug या levothyroxine, Synthroid. So now we need to give it IV to the client. Correct? Give warm blankets to the client and other supportive care. Even we may need to mechanically ventilate the client क्योंकि respiratory distress हो सकता. Then we need to place on mechanical ventilator. Right. So these are the main points for thyroid storm and myxedema coma and their management. Hope you understand all the points. See you soon in the next video. All right.